About 37 million people around the world are infected by HIV, making the disease one of the worst pandemic in the modern history. HIV statistics in Malaysia, 1986 to 2022. The first HIV case was recorded in 1986 with only 3 cases. The peak occurred in 2002 with 6,978 cases, but it decreased to 3,177 cases in 2022 due to initiatives such as Mother-to-Child Prevention, 1998, and free ARV treatment. AIDS, or acquired immunodeficiency syndrome, is a disease which a human immune system is heavily impaired caused by the human immunodeficiency virus and the last stage of virus infection. There are 3 stages of HIV: primary HIV infection, asymptomatic phase, and AIDS. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, specifically targeting CD4 cells, which are crucial for fighting off infections. Left untreated, HIV can progress to AIDS, which stands for acquired immunodeficiency syndrome. In this severe stage, the immune system is so damaged that the body cannot fight off infections or diseases. Scientists believe that HIV originated in West Africa, and this can be supported by cases found in chimpanzees and gorillas who has the similar virus. HIV is spread through certain bodily fluids, such as blood, semen, vaginal fluids, and breast milk. It's important to understand the main ways HIV can be transmitted. One of the most common ways HIV is transmitted is through unprotected sexual contact. Having intercourse without a condom or other protective barriers can result in HIV transmission via semen, vaginal fluids, or rectal fluid. Another high-risk behavior is sharing needles. For example, people who inject drugs may share needles, which can lead to HIV transmission if the needle is contaminated with the virus. The last risk is mother-to-child transmission can also happen during childbirth or breastfeeding. If the mother is living with HIV and not on treatment, the virus can be passed to the baby. But with proper medical care and treatment, the risk of transmission can be greatly reduced. HIV symptom. Know that the early stage of HIV, also known as acute HIV infection, typically begins 2 to 4 weeks after exposure. During this period, many people experience flu-like symptoms. These can include fever, fatigue, muscle or joint pain, and other similar symptoms. These symptoms occur as the body's immune system starts to respond to the HIV infection. It's a sign that your body is working hard to fight off the virus. However, it's important to note that not everyone shows symptoms during this early stage. And if they do, the severity can vary greatly. In some cases, the symptoms are so mild that they can be mistaken for a common cold or flu, or they might be missed entirely. That's why getting tested is so crucial if you think you might have been exposed. Early detection can make all the difference in managing HIV effectively. Remember, knowledge and awareness are the first steps towards a healthier future. Stay informed, and don't hesitate to reach out for support. While early HIV symptoms can be a clue, they're not enough to confirm a diagnosis. Why? Because these symptoms, like fever, fatigue, and body aches, are similar to those of many other illnesses, such as the flu or other viral infections. After the acute phase, HIV often enters a latent stage. During this time, symptoms might completely disappear for years, even as the virus continues to silently attack the immune system. To make things even trickier, HIV can present misleading signs. Relying on symptoms alone can delay diagnosis and treatment. That's why symptoms alone are not enough to confirm or rule out HIV infection. Testing is the only way to know for sure. If you think you've been exposed, don't wait. Early testing leads to earlier treatment and better outcomes. Protect your health. Get tested today. Pre-exposure prophylaxis, PrEP, is a daily pill designed to prevent HIV in people at high risk. When taken consistently as prescribed, it forms a powerful protective barrier, significantly reducing the likelihood of contracting HIV through sexual contact or injection drug use. PrEP is a proactive and effective method for safeguarding against HIV transmission. Post-exposure prophylaxis, PEP, is an emergency HIV prevention treatment involving antiretroviral medicines taken within 72 hours of potential exposure. PEP is used after events such as unprotected sex, needle sharing, or occupational exposure. It must be started promptly and taken as prescribed for 28 days to effectively reduce infection risk. PEP is intended for urgent, high-risk situations only. Preventing mother-to-child transmission involves pregnant women with HIV taking antiretroviral therapy, ART, during pregnancy, labor, and breastfeeding. Consistent ART significantly reduces the risk of HIV transmission to the baby, ensuring better health outcomes for both mother and child. Next is regular HIV testing. It is crucial for early detection and timely treatment, allowing individuals to manage their health effectively. For those living with HIV, antiretroviral therapy, ART, is essential. It reduces the viral load to undetectable levels, significantly decreasing the risk of transmission and improving overall health outcomes, enabling individuals to lead healthier, longer lives. Safe blood transfusions require using thoroughly screened blood from certified medical facilities. This ensures the prevention of infections, including HIV, providing a secure and reliable process for patients needing transfusions. Education about HIV promotes understanding of transmission risks and prevention. Reducing stigma encourages testing and treatment, creating a supportive environment for better health outcomes and empowering individuals to make informed decisions. Antiretroviral therapy, ART, is the cornerstone of HIV treatment. It uses a combination of medicines to suppress the virus, reducing the viral load to undetectable levels. ART improves immune function, prevents disease progression, and significantly lowers the risk of transmission, enabling individuals with HIV to live longer, healthier lives. HIV, human immunodeficiency virus, is a virus that attacks the immune system, specifically targeting CD4 cells, T cells, which help the body fight infections. Without treatment, HIV can weaken the immune system, leading to AIDS, acquired immunodeficiency syndrome. While there is no cure, antiretroviral therapy, ART, can effectively manage the virus, allowing individuals to live healthy lives and reducing the risk of transmission. Early diagnosis and consistent treatment are key to controlling HIV.